The new channel. The new channel. The views, opinions, and insights expressed in the following show are those of the hosts, producers, guests, and viewers. They do not necessarily reflect the position of the channel. Viewer discretion is advised.
Hey, we're the Talkers. I'm Chino.
I'm Tricia, and you're watching AfterShift, powered by the new channel.
Helping you see the new you. All right. Another awesome Wednesday, Tricia. Kamusta ka?
I know. Okay naman. Just got off from work kanina.
All right.
So madaming trabaho as usual. I'm reporting on site today. And syempre, I'm taking all precautionary measures naman. We all know that the numbers are still increasing as the day goes by. Ikaw, Chino, how are you?
I'm doing great, Tricia. So far, it has been an awesome week. Kaya lang, medyo mas mamalang yung pakiramdam ko yesterday. Slight headache. Kaya medyo nakakainis pagka, nagme-meds ka tapos medyo groggy ka, 'di ba? Meron akong tinatry na may pinatry sa akin yung wife ko na parang something to soothe the ano ba to? Yung parang sa nose and yung sa head talaga.
Ang tawag
it's called
dyan,
Tricia.
inhaler?
Hindi naman inhaler, pero basta siya parang minty yung minty yung amoy niya. Pero very relaxing, promise. Sabihin ko sa'yo mamaya kung ano yung pangalan. Anyway, thank you so much for catching us here. On TNC, everyone. Welcome to our 5th episode, and we are so excited to again bring this episode or this show to you once again. Catch us every Wednesday and Friday night, 8:30 to 9:30 p.m. here on the new channel. And of course, make sure that we're able to remind everyone kung meron kayong comments, questions, or suggestions. Lalo na ngayon, mabigat-bigat. Alam, lagi naman mabigat yung mga guests natin Pero ito, napakabigat. Mamaya malalaman nyo kung bakit napakabigat. But if you have any questions or comments about the topic, of course, and about our guests, please make sure that you're able to utilize the comments section down below. Yeah. So you mentioned kanina, Tricia, sabi mo, galing ka ng work, reporting on-site ka pa rin?
Yes. As of the moment, I am currently reporting on site.
All right.
Medyo alternate naman actually siya. Yun.
Okay. So what's it like and gaano ka, what's it like to work, on site tapos biglang work from home? And you know what, to be honest, Tricia, kaya ako tinanong kasi hindi na ako sure kung gaano tayo katagal naka-quarantine. Do you still remember how long we've been on quarantine? Grabe na, no? Ang tagal na rin.
Teka, iniisip ko Medyo nagkaroon kasi ako ng selective memory loss Charot. But to answer your question,
Grabe,
Chino,
no?
We were on quarantine since March pa. We're roughly on our 5th month of community quarantine. Bakit mo naman naitanong?
Oh yeah, that's right. Oo, natanong ko lang kasi yun nga I mentioned about you working on site, you working from
Mhm.
home, and I like to know, yung kumbaga in general, how you feel about yung safety mo. Can you rate it from 1 to 10? When I say safety, kasi since you're working on site, obviously
Mhm.
you go to work, right? You go to your office,
Right.
and I just want
Mhm.
to know from 1 to 10, ano ba yung rating mo on how you feel in terms of security or in terms of your health, you know? With 10 being the safest, ano rating mo, Trish?
All right. Teka, hirap ng tanong na yan ah. But before I answer that question, ilalabas ko lang aking disclaimer card.
Okay.
Whatever my answer is, it's my opinion and it's based on my experience. The channel is not held liable for any joke lang.
Yun, ano? The views?
So,
Yun. Hindi ko kaya.
the views and opinion of the host.
Right.
Yan. Siguro I would rate it as 7. 7 siguro.
Okay. Oh,
Why?
bakit naman 7?
Why kasi generally I feel safe naman when I go to the office because we implement strictly yung social distancing, as in we have yung mga acrylic parang boards to separate us, tapos one seat apart talaga, meaning if you're seated in a station, yung katabing station walang tao. And also, we are being asked to eat na lang sa station. Actually, namimiss ko nga yung, to eat your lunch or to eat lunch with your office mates, diba? Kasi parang yan yung time nyo to bond. And aside from that, we also undergo yung every 14 days yung rapid testing. So we are also given free face shields, mask,
Oh,
and vitamins naman ng company.
wow.
Also, naman, pag pupunta naman ako sa groceries, feeling ko naman din safe because I see the staff, sanitizing the carts. Tapos, dun sa mga escalator, diba? If you've been in one of the malls, meron naman silang UV light thingy to help sanitize yung railings ng mga escalators, and very strict din yung guards in implementing social distancing. So kudos to the malls and groceries who's actually very strict in implementing these guidelines. So yun.
Wow.
Generally, I
It
feel safe
sounds
naman.
it sounds
Mhm.
safe, Trisha. Pero I'm just really, wondering overall, considering all of the things that you've said, bakit
Mhm.
7 lang yung I know I've been asking it earlier pa, kung bakit 7, pero
Mhm.
ang dami mong sinabing magaganda in terms of ensuring na safe lahat and all that. Pero bakit kaya
Mhm.
7 pa din ang iyong rating? And medyo ko doon medyo curious ako kung bakit 7.
Ano ba? I think yung reason is because this is just my opinion, and this is what I have been noticing. I think some people are not really practicing or not conscious about these guidelines that were set. For example, I can see that sadly some people are not really practicing social distancing. Like sa grocery. Minsan hindi mo napapansin meron ng tao sa likod mo, not waiting for you to get out of the aisle before they go in.
Right.
I think siguro I think it's a conscious effort, I think, for everyone. And I see naman some people who's also doing it. And maybe because siguro as a society, diba, Filipinos really are very close knit. So these things that are being implemented now, it's really challenging for us Filipinos to follow. But I guess it needs to be a conscious effort for everyone, to follow social distancing. And one experience pa pala, Chino, that I'd like to share. So
Mm.
nung nag-grocery ako last Sunday, so I normally do my groceries sa morning kasi, so I don't eat breakfast na. So once after I'm done, I went to this food stall to buy something. And then si ate who was preparing the food, Well, she's wearing a
Okay.
cloth mask. I don't mind naman na she's wearing a cloth mask. Maybe that's the one that she can afford, no? But as she was preparing my food, she was actually talking to someone over the phone. Naka-headset siya, and she was preparing my food and she was talking. And siguro it's my fault as well na hindi ko siya kinall out about it, but I ended up throwing the food away because sobrang natakot lang ako about
Yeah.
it. Pero yun. So I think so for me, that's the reason why it's a 7 because I don't think everyone is really practicing yung mga guidelines that were set by the government and by these institutions.
So
Yun.
it's not really the precautionary measures, no? It's more of the people who's actually parang yung dapat na gumagawa, nag-i-implement nito mga measures nito. And I cannot blame you, Trish, if you ended up throwing it away. Kasi nga, I think I mentioned in one of our episodes wherein yung paggamit ng mask,
Right.
a lot of people would just end up using the mask just for the sake of using a mask. Hindi natin iniintindi yung proper usage of the mask, and I'm sure a lot of our viewers out there are very interested, to inquire, to know more about how to properly wear your mask, cautionary measures, and itong bigating guest natin na to will definitely be able to answer that. Excited ka na ba, Trish, na makita at malaman kung sino tong guest natin na to?
Yes. Parang di ko alam, di ba?
Yes. Okay, medyo na-delay na ng konti. Parang nag-lag lang ng konti. Pero sige lang, yes. Oo. To introduce to you guys, everyone here in our audience, who our special guest is, this person is a graduate of Intarmed program of the University of the Philippines, College of Medicine, got his master's of public health degree from the Institute of Community and Family Health, Inc., of the Mundo Human Resource Development Center for Health. Siya rin ay naging class spokesperson for the 2004 batch of the Management for International Public Health course held by the Sustainable Management Development Program of the Centers for Disease Control and Prevention not here in the Philippines, in Atlanta, Georgia. Okay? He started his public health career as a project physician at the Research Institute of Tropical Medicine, or RITM, and later on as the head of the informatics unit and subsequently the training officer of the Field Epidemiology Training Program, or FETP, of the National Epidemiology Center of the DOH. Okay, he is also a professor or a lecturer at the Ateneo Loyola Schools for the Health Sciences Program and the Ateneo School Government Master of Public Management course. He had also previously been a lecturer in public health epidemiology at the UP College of Public Health and the Ateneo School of Medicine and Public Health. Medyo mabigat talaga. Matindi ang resume. He is presently the chairman of the Department of Community Medicine at New Era University. And aside from the SARS, avian influenza, MERS, Ebola. He is currently, one of the consultants na dito sa ating COVID-19 pandemic, And until 2019 of December, this doctor was a consultant at the DOH Office of the Assistant Secretary under the Health Policy and Systems Development Team. He has been a consultant for the Senate Committee on Health and Demographics, and it's under the supervision, of course, of Senator J.V. Ejercito during that time. And he is actually also very instrumental in passing on the pre-bicameral preparatory meetings for RA 11223, and that is the Universal Healthcare Law. And currently, hindi pa tapos yan, Trish. He is still working under the Senate Committee on Health, under the chairmanship of Senator Christopher Lawrence Go, or Senator Bongo. Yeah, kasi mabigat talaga yung ano natin, yung guest natin eh. So, huwag na natin patagalin pa. I'm so excited to talk to this person, and I'm sure you are, and I'm sure our viewers are. So, let's bring in Dr. Troy Gepte, Public Health Epidemiologist.
Hello, good evening,
Hi,
Chino
Doc.
and Tricia.
Good evening, Doc.
Nice
Doc
to join
Troy,
you here
good
sa
evening,
program.
Good evening.
Good evening.
Doc, okay ba yung intro ko sa'yo? Hindi ako
Sobra.
nagkamali.
Parang nag-iisip ako, sino kaya yun? Joking aside, thanks talaga. It's a pleasure to be here with you, and I really would like to share some thoughts or ideas about what I do or about what I am currently doing on COVID-19. So
Mhm.
anyway, fire away. I'm so glad just to um, have this kind of opportunity to join you dito sa program.
All right. Thank you so
Thank
much,
you.
Doc, for being here. I know you are a very busy person. Kanina, when we were talking backstage, minention mo nga na you were just, you came from another guesting, no? From another
Mhm.
network. Kalaban ba ng
Yeah.
TNC yan? Hindi. Kasi ba ng TNC yan? Hindi. But kidding aside, I know you are very busy. Alam namin ni Tricia yan. And we are very excited to know more about, again, the precautions that we should be
Sure.
doing, to fight
Mhm.
COVID-19. Pero syempre, Doc, hindi lang tayo mag-usap din tayo about you.
Of
Right.
course.
Because you are actually a topic for tonight. Let's have tonight, okay? So, Doc, first things first, kamusta ka dyan? I heard that you are from Quezon City. Kamusta ang situation dyan? And also, aside from that, alam po namin na you are also part of the ITF. Medyo mabigat na
Right.
task, for our country.
Mhm.
So siguro simulan na muna natin, Doc, no? Kamusta ka muna? And let's jump to the IATF thing.
Sure. Here I am in Quezon City, Diliman actually, Quezon City. And as you very well know, Quezon City is one of the hotspots for COVID-19. So medyo, safe naman dito sa bahay. Most of us from the office are working from home. But at the same time, you see, Bea, my wife, is a doctor. So we try to talk about yung risk when going outside. And as a doctor, na-expose ka to other people or other yung mga patients. So talagang sobrang pag-iingat tayo talaga ngayon. We're happy na sad na nasa MECQ tayo ngayon. Coming from GCQ, which we've had for 2 months, ngayon nasa MECQ tayo. Parang it gives us some kind of assurance that we're still trying to monitor well kung ano nangyayari sa situation natin. And specifically here in Metro Manila, talagang medyo mahirap talaga dahil sa may mga areas or hotspots na talagang tuloy-tuloy pa rin yung transmission ng COVID-19. But having said that, my work now is really to help inform sa Senate, or my work then is to coordinate with the DOH and other government agencies. So, very busy yung ating mga government agencies, yung ating mga national government agencies to help develop further kung ano yung mga plans natin to come up with a good response para mapigilan natin yung pag-spread ng COVID-19. But having said that, importante talaga yung role ng ating mga local government units, yung mga cities and municipalities. Our mayors are really in the fight against this virus in this pandemic. We hope that we'll have more success stories siguro in the coming weeks and coming months. So we'll have to do good this 2 weeks of MECQ, and we have barely a week, ano? Ang deadline kasi yata is August 18, yung last day for MECQ. And based on what has happened this past 2 weeks, we'll see kung we'll have to continue MECQ or baka gradually nasa GCQ na tayo. And okay yun for our economy. The problem with all of this community quarantine o itong mga lockdown ito, nahihirapan talaga makabangon yung ating mga kababayan sa trabaho nila, nawalan ng trabaho marami. Tsaka mahirap talaga magbigay ng yung amelioration, yung sa ayuda natin dahil sa mauubos talaga yung pera natin. Pero anyway, that's parang a short intro of where I am now and what I'm doing. Back to you.
You mentioned kanina, Doc, no, that the LGU also plays a big part or the responsibility of enforcing the guidelines that were set by the IATF. And I also believe that the private sectors as well have a role in this. Now, based on on your observation, medyo controversial tong question na to, but how do you think we fare as a country in terms of our response to the pandemic? So we're talking about the response of the private sectors, the LGU, and the people.
Yeah. So at this point, pwede rin ako mag-disclaimer na everything that I say will just be a personal opinion.
Sure,
But anyway, yung like from 1 to 10, parang you were discussing kanina. I guess we are at a mga around hard 6, maybe 5 to 6. Talagang we really have a long way to go kasi we really need to work well with our partners from the private sector talaga. They are helping us, but we really need to give them guidance on how they can help us. So marami kasing mga initiatives from private corporations, from NGOs, a lot of these other organizations and institutions are very willing to help, but we also want them to be safe. We want them to ensure na healthy sila, di sila mahahawa. Kaya talagang the government is really trying to find a way para ma-augment pa yung ating mga manpower. So I think in terms of how we're going about itong 5 months of community quarantine from ECQ to MECQ to GCQ, may mga lessons learned na tayo eh. And we're not unique. What is happening to us is also happening to other countries. Foremost, United States, where they have the most number of cases, followed by, I think, Brazil or India and Russia. So these developed countries also have the same problems as we have. The good thing is that we are learning from each other, and then what we've seen is that medyo gumaganda na yung testing natin. If you remember, during the first few months, from March, April, May, I think, medyo kakaunti pa lang yung mga laboratories ngayon. Marami na. But we still have a lot of patients talaga. We still have a lot of people who are currently being tested. It just shows that talagang marami pa rin yung transmission. Kaya mataas pa rin, matindi pa rin yung pagtaas ng kaso natin. Yeah.
Right. And I think that's one of the problem with COVID kasi it's very fast. I mean, the spread is very fast. Like isang tao lang meron, it can spread to 5 more people, I guess. So I think we really need to be very cautious, diba? Follow all the proper protocols when we are outside. So we will learn more about that later. So we will get to know more about Dr. Troy later as well. But for now, let's pause for some announcements. Right. So welcome back to AfterShift. So let's take a look at some of the comments first, sa StreamYard. But before we do so, let's call back Dr. Troy. So we will be reading some of the comments that we have from our viewers. From June Ilagan, he says hi. And yan, hi Doc Troy.
Hi.
Oh, my
Hi,
mom,
June.
my mom is watching pala. Melanie C also
Good
says good
evening.
evening, Doc. Ayan. You know, Tricia sounds like a TV news anchor. May potential ba, Doc?
May potential.
Ayan. We would also like to say hi to Dimple Gungan, who's also watching. Yan. Nina May Rivera, who's also watching. Oh, June Ilagan Doc says, thank you for your honesty.
Thanks, June.
Ayan.
Welcome back. Welcome myself back. I want to welcome myself back. Doc, as we continue on with our with this special interview, no, kanina, syempre, maraming mga articles or maraming mga posts, on social media that were looming around, and it's about, the one word that a lot of people are actually praying for, no? Alam mo ba yun, Tricia? Alam mo ba kung anong word yun? It starts with the letter V.
Yes, I know.
Okay? Yun. Doc! Vaccine! Kamusta ba, Doc?
Vaccine.
Ano bang,
Oo nga.
what is your take on this vaccine that is already, I would say, established na daw, sa Russia. And then there's also this vlogger, no, who's also claiming that nasa third or final stages na daw yung vaccine, no, that can really help us fight COVID-19. So, your
Yeah. Yung vaccine is something that the president is personally really looking forward to. Sana kung makalabas ito this year, that it will mean a lot talaga para do sa efforts natin to somehow reduce yung number who might be vulnerable to COVID-19. It's a new virus kasi itong COVID-19, which parang emerged, lumabas lang ito nung late last year, last quarter. And I think December 31, dun pa lang talaga siya na-identify. And then, kumalat na siya all throughout the world. So mabilis, very transmissible siya, very infective. And unfortunately, wala tayo antibiotics, antibodies against this new virus. Kaya yun ang iniingatan natin na sana, like for some countries, pag na-expose daw, parang they think that herd immunity or yung immunity in the population will help us. But it's really taking a long time. And ang balita is that this virus can mutate, can change. So whatever immunity we might have, baka pag nagbago siya, kailangan na naman natin ng panibagong infection and then may immune na naman tayo. With the vaccine, this kind of technology can help us. Parang tinutulong niya yung body to help build yung mga antibodies natin to fight off itong virus even without getting the infection. What they do is that they have a weakened kind of virus, and then yung body mo kayang-kayang matalo yung virus na yon. And then it builds our own immune system, and it produces a lot of antibodies. Unfortunately, it takes a long time, a year, maybe a year and a half, para talaga makakuha tayo ng effective and safe na vaccine. So itong balita from Russia, it's definitely good news, but at the same time, we have to be very cautious as to how many people have already been tested or itong mga na subject to the vaccine trial. As an experiment, yung mga clinical trials or vaccine trials really take some time. So, hindi lang kasi yung kakaunting tao and then you'll release the vaccine to millions of people. Kailangan, we have to substantiate itong mga evidence by looking at the same thing, confirming the evidence in a lot of other places, other countries, even here in the Philippines. So far, we have, I think, 6 candidate vaccines that already have yung nasa phase 3 na. So pag sinabing phase 3, ibig sabihin, pwede na yan magamit kahit initially dun sa mga yung intended na babakunahan natin. So hopefully, dumami pa yung ganitong klaseng studies, and the research will still grow pa. But as of now, I think personally I have to be very cautious kasi hindi pa natin masabi kung the vaccines that will be produced by Russia or any of these countries na medyo napapaaga sa paggawa ng vaccine will be really reliable. So again, yung bottom line dito is that we have to determine kung effective and safe siya, and it takes at least a year or a year and a half. We hope that magawa to within 6 months, but the virus is essentially a new kind of virus. Hindi siya gaya ng trangkaso or yung mga influenza. This is a very different kind of virus, kaya medyo ingat-ingat lang tayo. Yeah.
Okay.
All right.
Thank you, Doc.
Doc, thank you so much for that information.
I'm curious pala, just a curious question. So when a vaccine or a new vaccine has been developed and it goes to testing, how would you normally profile the people that will be part of the testing? Do they get like a specific blood type of people, something like that?
Yeah, I usually basically we get volunteers dun sa testing. We try to invite many people within communities, and then try it out yung sa vaccine. And then tingnan natin over time, a few months, whether their antibodies are really going up. But before that, tinatry natin muna makita kung ano yung proper dose ng vaccine, kasi sometimes might be na baka underdose or overdose, and may mga side effects siya. So medyo iniingatan natin kung ano yung bibigay dun sa maramihan. We test it out in a few number of people, and then paunti-unti dumadami yung samples or subjects natin. And then pag phase 3, medyo confident na tayo na mukhang mag-work ito. But when we're in the real world, medyo iba pa rin. Baka there are some vaccines that might not perform as good as the other vaccines. So medyo hit and miss pag sa technology for vaccines, and also for drugs and medicines in general. So it's really going to take a lot of time to monitor yung effects of these new drugs and these vaccines.
All right, Doc. Again, maraming salamat for explaining that. I saw a comment earlier. Sabi ni, I think it was June Sabi niya, wala nang i-layman's term pa. Ayan ang ganda ng pagkaka-explain ni Doc about the vaccine or how it works. Very layman na yan or yun nga, in layman's term na. Siguro, my comment lang on what Doc said. The only thing that we are trying to avoid dito, since we're talking about the term vaccine, is yung complacency ng tao. Kasi ang inisip ng tao siguro, may vaccine na, pwede na tayong, natin gawin yung gusto natin gawin. Pwede na tayong hindi
Yeah. Dapat hindi tayo maging complacent.
Doc, may pa tayong reality, ika nga. So, maging complacent talaga. So, Doc,
Yes, Chino.
So, Tricia, let's talk more about Doc naman muna.
Sige. All right.
I'm sure a lot of our viewers would also love to talk about and learn more about. So, maglaro tayo. Ano ba tong game natin na Tricia?
Game.
Right. So, Doc Troy, we want to know you better. So, we will play a little game. So, we have this segment called #this. So, we captured some of your photos, and we want you to create a hashtag.
Wow.
Yan.
Okay.
Ready ka na ba, Doc?
Ready na, pero kinakabahan.
Parang lahat ng guests natin, Chino, kinakabahan sa hashtag.
Everyone is saying na medyo kabado sila prior, no? Pero pag nag-start na, medyo okay na, comfortable na. Pero Sige, let's see.
But
Doc, first
excited.
picture. Here we go.
Oh, wow. Ano to? This is my wife, Bea, getting a picture of me. Ito yung sa bridge dito sa may Manila. I forgot. Jones Bridge yata. So,
Yeah, Jones
hashtag ko dito, hashtag feeling pogi.
And who's taking the picture, Doc?
Yeah,
Is
that's
that your
my wife,
your
Bea.
wife? Yeah.
She has a new
Kaya
phone
pala.
kasi at that time. So, talagang post talaga ako. Post to post talaga ako.
Doc, tanggalin na natin
Hashtag.
yung feeling. Hashtag
Oo.
pogi na lang, Doc. Yun
Pogi
yata
na
yung mas
lang.
appropriate na hashtag para dito.
Bawal kumontra ha, kung sino man.
All right. Next image.
Oh, wow. Ito yung this was a picture of me before and after I got my haircut. Again, yung wife ko, pinagtiyagaan niya akong gupitan. So this is hashtag ECQ haircut. I guess. Do it DIY haircut.
Hashtag. Tricia, ikaw ba
Hashtag
nakapagpa-haircut ka na ba sa bahay?
Hindi actually nung na-lift yung nung nag-GCQ tayo, yon that's the time that I had my haircut. Pero humaba na siya ulit. So
Yun pala ang common denominator namin ni Doc. Kami ni Doc naka-experience ng haircut sa bahay because of the pandemic. Yan.
haircut
Salamat
lang yung
by the
lakasan
wife
ng
na
loob.
yan.
Lakasan ng loob. All right, next image.
Okay. Hashtag samurai.
Hashtag
we had
samurai.
this parang trip to Japan, and we went to this place where they had us all in costumes. Tapos myself and my wife, naka-samurai din si Bea dito. My daughter naka-gi siya, and my son is in ninja. So hashtag samurai para sa akin yan. I remember how it felt like.
Ang nai-imagine ko dito, Tricia, parang Incredibles Parang superhero na papatayin yung COVID-19. In fact, si Doc Bea mas naka-ready, nakahawak na dun sa sword. Nakita mo?
Actually, we had a picture, medyo malapit dito sa picture nito, where she was trying to draw a sword, and ako lang nakatingin lang ako sa kanya. So, she was really into it.
Talagang game face on,
Yeah.
Tricia, ikaw yata yung nasa likod nila Kita mo ba yan? Ikaw yata yung nasa likod nila
Nagbabantay.
Grabe ka.
Mukhang mahilig sila Doc mag-travel din,
Oo.
Mahilig yata sila Doc mag-travel din at the same time.
Every
All right,
year
image number 4.
Wow. We have a telescope. We bought it online. And yon, hashtag moon watching.
Moon watching.
Wow. This is our son.
Ganyan talaga kalaki, Doc, pag nakita.
Yes. Ano siya, medyo tsatsagaan mo, you put the camera phone dun sa eyepiece, and then try to slowly, very carefully get the image. Pero one of the better shots to. I think I have 2 or 3 posts na may full moon It's hard to get ng tama. Kasi problema dyan, yung gabi pa siya, like madaling araw, like 2 a.m., 3 a.m. pa siya minsan. So minsan ginigising ko like my son, anak, halika na. Nandiyan na yung buwan. Pwede natin tingnan. Moon watching.
Yeah.
Tricia, ang ganda ng bonding nila. Have you ever tried, Tricia? Nakapag-moon watching ka na ba? Or...
I remember nung bata ako sa school, we had, parang we went overnight sa school, tapos may nag-set up from the Philippine Astrological Society ata yun. They set up a telescope. Yeah. So, yun, they teach you.
Yeah. Same here. We have friends also from the same organization, sa Philippine Astronomical Society. Sometimes, I think we've done it twice. Parang kami, like pitch ng tent, and then we watch stars and meteors. So nakakatuwa para sa mga bata at sa mga matatanda.
I think parang 12 midnight to 2 a.m. lumalabas halos lahat
Yes.
ng stars. Yan, yung natatandaan ko. At isang
Unfortunately,
constellation lang ang alam ko.
Yeah. yung unfortunate sa atin sa Metro Manila, marami kasing light. They call it light pollution. Pag kailangan lumabas ka pa to the province para medyo mabawasan yung light. Para makita mo yung mga stars. Yeah.
Okay. Let's move on to the next picture. Thank you, Doc.
Wow. Meron pa.
Next picture? Or is this the last one, Chino?
Anong hashtag natin dito, Doc?
Wow. Hashtag boss.
Hashtag boss.
Si Senator Bongo is a very active senator. He has a lot of legislation. Siya kasi yung Senate committee chairman on health. So we get to talk a lot. Sometimes there are some bills that will really be important if you prioritize. So he gives us this task to go over the bill and then try to help him prepare kung ano yung mga kailangan. Fortunately, at this day, Anton was, my son Anton, was with us. Parang may field trip eh. Tapos, nakiusap ako doon sa staff if we can get a picture with the senator. And he was, willing to oblige naman. Kaya yun, habang yung mga ibang mga kaklase niya, somewhere, nasa loob yata ng session hall. So, hinila ko siya para makilala si hashtag boss.
Oo nga, hashtag boss. Ang ganda ng very nice picture po.
Honestly, si Senator Bong is quite a nice
One last
guy.
picture. Bonus picture.
Wow!
Oh. Sana makilala natin Tricia si Senator, no? Pero ito, bonus picture po.
Bonus picture. Anito, ano ba masasabi ko dito? Hashtag pagod, pawis. Kasi may konting hiking yan may trekking. Tapos we had to step over big boulders and rocks just to get to that place for that shot. Actually, we went to Mayon Volcano. We went to Albay sa Legazpi. Overnight lang kami doon just for us to get a good picture na may backdrop kami na Mayon Volcano.
Wow.
Tapos a few hours later, umuwi na kami niyan. Nag-plane na kami. We went there by bus. Tapos nag-plane na kami pa uwi. Tapos on the way there, yung bus namin, nasira pa siya mga 4 or 5 hours. So instead of arriving in the morning, we arrived near evening na. But anyway, the morning after was a great day and we got good pictures during that time. May zipline pa yan.
Doc, maganda yung pag-levitate mo dyan, Doc, ha? Medyo parang
hirap na hirap.
Parang may gusto mo lumitaw parang may gusto magpakita pa, Doc Pero ang galing, buti na
Di matago.
Hashtag di matago.
Di matago.
So, yan yung bonus image or picture namin para sa'yo, Doc. Again, thank you so much for playing this game with us, Doc. Nakakatuwa naman na marami kaming nalaman pa about you. Hindi ka lang napakatalinong tao. You're also into traveling and into yung moon watching, tapos astronomy and a lot more, So galing, nakakatuwa, Tricia. Amaze ako kay Doc. Ano ba naman 'yan?
We try to give experiences. Sometimes kasi pag naisip ko what we can leave our kids, sometimes syempre you need to work, you need to give them some kind of assurance that we have money, we have like this. Pero we want also to build that in meron kami mga experiences that we share together. So before, I'm a very private person, so alam to ni Bea So I don't really have many pictures na nakakalat. Pero
Mhm.
I think from 3 or 4 years ago, we were collecting pictures. Ngayon, napupunin na yung wall namin sa bahay. And every now and then, napapangiti kami every time na dumadaan kami sa wall just to look at all of those places that we've been here in a couple or 3 countries outside the Philippines. Yeah.
All right. So thank you, Doc, for sharing or allowing us to get to know you better and share the memories that you had with your travels and your interests with our viewers. So
Yeah.
we will get to know more about Dr. Troy after his shift of being an epidemiologist and working for the health committee. But before we do, let's pause for some announcements.
Welcome back to AfterShift powered by TNC. Gusto ko sanang mag-hi, sa lahat ng ating mga viewers tonight. Thank you very much for being a part of the show. If you guys have any questions, comments, and whatnot, in relation to what Doc Troy is actually talking about, which is yung COVID-19 and yung mga precautions natin, please, leave those comments on the comment section down below, and we would very much appreciate that. We'll read that later on once again. But for now, we would like to invite you to watch our inspirational shows. First up, The Big Picture with Lloyd Luna shares inspiring stories of notable personalities, streams Monday to Friday, 7 p.m. Next is HR Hotline, which introduces us to the wonderful world of human resources management. That's every Tuesdays, Thursdays, and Saturdays at 1 p.m. iBusiness talks about inspiring business insights, live streaming from Tennessee and Texas in the USA, Tuesday and Thursday, 8:30 p.m. Central Standard Time, and Wednesdays and Fridays, 9:30 a.m. Philippine Time. The Fort Project is about life, business, and success stories, live streaming from Dubai, UAE, 7 p.m. and 11 p.m. Philippine Time.
All right. So learn your life's purpose by tuning into U-Turn Mondays and Thursdays at 10:30 a.m. The Home Buyer is where you hear inspiring stories about building and owning a property. Streams Mondays and Thursdays at 4 p.m. Laugh and learn through the Puppet Stories Tuesdays and Fridays at 5 p.m. Magbenta, bumili at tumulong dahil bukas na ang TNC Marketplace, an online night bazaar, live streaming every Thursdays and Fridays at 10 p.m. Now, this is a new show that we have, which is YOLO, with attorney Carlo and attorney Sheila. That would start on Thursday, but it will stream Mondays and Thursdays at 8:30 p.m. Two leaders in one platform every episode. That's TNC. The Talk streams Mondays at 12 noon. Please don't forget to follow our page, TNC Now, for more updates.
And if you guys enjoy watching us, please follow AfterShift on Facebook and Instagram. We also have our Twitter account as well. So yun, please share nyo tong video na to, And again, after_shift is what you will type as you search us on Facebook, Instagram, and Twitter. Now, let's bring back
Yes.
Doc Troy. Very exciting part of our show. Doc, hello. Hello,
Yes,
Doc.
Chino. Yes,
Yeah.
Tricia.
Yeah.
Welcome back.
So,
Naka-recover na ako dun sa game.
ayun. Mabuti naman, Doc, kasi meron pa tayong mga ibang may init na questions.
Yun.
Sure.
All right. So I know, Doc, you're very busy, especially right now. You know that you have your I think daily committee meetings to, no? It happens almost every day, right?
Yeah.
So do you still have your me time?
The good thing is, right now, most of the things that we do are really online, mga meetings. We used to
Mhm.
have meetings where we have them face to face, large conference hall. But
Mhm.
there was a time that marami na nakakasakit, and it was best na ano na lang, to transfer to a new platform na nag-online na lang. So right now, I'm not as involved as before, but I still try to keep in touch with our colleagues on kung ano yung mga present concerns sila. We used to really talk about testing before. Now there's a lot of other things, mga quarantine, contact tracing, and reminding people to communicate to them kung ano yung importance of wearing mask and social distancing. Talagang kailangan di ka magsasawa mag-remind talaga sa mga tao eh. And
Mhm.
it has to be done talaga na i-encourage mo sila. Sometimes kailangan medyo a little draconian ka, kailangan medyo matakot yung tao, pero at the same time you want to appeal to their
Mhm.
sense of reason and sense of looking after their family, their loved ones. So sa akin na iuwi ko yan minsan. Sometimes I try to leave it outside. Kunwari after the meeting, online conferences, I try to take a mental emotional break talaga. Sometimes kasi sobre.
Mhm.
I watched something the other day tungkol kay Mr. Rogers, Mr. Fred Rogers. I remember what he
Mhm.
said, something about we should go into some kind of stillness, and within that space it helps us parang makarecover. Marami talaga nangyayari ngayon na yung threat to our health and safety. And most of all, isa kakaisip natin to, nakakalimutan natin minsan yung emotional, mental, spiritual well-being natin. So I try to spend as much time with the kids, and I try to get involved in what they're doing. So right now, nagtra-transition kami to homeschooling basically, or blended
Mhm.
learning. So it's really something that medyo 100% kami trying to see how we can transition kasi this won't end really soon. Even if may vaccine
Mhm.
tayo, I think we'll have the
Right.
precautions until next year pa. At least next year.
Okay.
Alright, napanood ko na rin yan, yung kay Mr. Rogers, yung si ano,
Mhm.
Yes, yes.
what do you call
Tom
this?
Hanks?
Si Tom Hanks, that's right,
Yeah.
oo.
Mhm.
Trisha, if you have not seen it, you better
I
watch it
haven't.
because it's
Oo.
very napapanahon yung
Mhm.
yung message ng movie na yan. Okay? Actually, Doc, you mentioned already about yung you trying to leave, yung work mo outside the door as you enter your house, no? So, and you also mentioned homeschooling.
Mhm.
What other things is enabling your family to adjust to your busy schedule?
Yeah.
Medyo hectic talaga ang schedule niyo,
Yeah.
Doc, eh. So paano sila nag-a-adjust sa schedule, sa busy schedule niyo?
It's a blessing and also somewhat of parang a challenge yung internet talaga.
Mhm.
Everything's really connected from calls, conferences, um, personal messages, social media, the entertainment through movies, watching Netflix or YouTube, or games, online games. So talagang we really value siguro ngayon how close we are together, like now sa social media or through parang reaching out to people. Mas madali na ngayon, but at the same time, may irony eh. It makes you think na we're really all apart from each other right now, at least physically. So, I think sa pag-adjust namin, yung internet is really something that parang it's really somewhat of a blessing for us talaga. And we try to also remind ourselves pala na syempre we can't really go to mass right now. So dapat talaga on weekends, Sundays we go to mass as a family together. So parang yung mga bagay na hindi na magawa before, ngayon nagagawa namin together na parang dati kasi parang wala pang mga mass eh. Ngayon parang every Sunday kasi lagi mayroong mga naka-stream or recorded na mga mass. So, isa sa mga gagawin din namin hopefully is to be able to converse din with each other. Kasi sobrang internet, baka ma-overwhelm kami. Kailangan may mga mapag-usapan kami. So, nakakatuwa, among all of us, yung youngest namin, yung pinaka, how do you say it, siya yung lagi nagsa-start ng conversation about what he thinks, what he feels like doing. So, kami, we're happy to to discuss what he likes to do or ano yung mga naging parang frustrations niya. Kasi last year nabitin yung mga students, yung mga kids namin from their school. Actually, our youngest Anton is graduated from grade 6 elementary, and yung oldest naman namin, we have only 2 kids, si Bianca graduated from high school. So nag-online na lang sila na parang recognition ceremony. And next week may graduation kami, and the week after, I think may graduation na naman kami pupuntahan, pero online lang. So talagang sobrang adjustment. Pero at the same time, parang we feel safe and we feel parang kahit paano may blessings pa rin tayo. Kahit maraming mga nangyayaring hindi maganda, we can still be intact as a family kahit paano. And maganda, we can still contact our other relatives, our friends, anytime through the internet. Yeah.
I totally agree, Doc.
Right.
Tricia,
I think that's the
masabi ko
power
lang, no?
talaga.
Yes. Trish, masabi ko lang, abangan mo yung dalawang anak ni Doc Troy. Malay mo, yan ang maging future leaders natin or yan ang mga tutulong sa ating DOH. Kumbaga, yung mga future na whatever na ma-experience natin. Yun, yung dalawa na yan, aabangan ko yan, sigurado. So thank you, Doc. Thank you for sharing that.
Right. Ako naman, so Doc keeps saying na, diba, the kids are now going to study from home and everything will be done online. I think this pandemic actually is teaching the kids of this generation, to be flexible and to adjust with what they were used to. So maagang lesson to sa kanila about flexibility and adjustment.
Right.
Yan.
Uh-oh.
So, Doc, we have this question for you. What advice naman can you give our viewers on maintaining a healthy work-life balance, especially during this pandemic?
Yeah. I've often heard from some colleagues and friends na they've been so busy right now. We can really get busy from morning to afternoon to evening. And then parang walang pahinga. There are so many conferences and meetings and works and email and messages to attend to. And you need to study talaga. We need to read a lot, all of this information. So, ang important dun is try your best, try our best talaga, not to yung reach our max. Sometimes kasi ang gusto natin is to be very effective, but we're not getting that efficient ba in what we're doing. So it has to be a balance between both. And to be efficient, we really need to step back a while, and then see what's happening. So it's really good if we do, like dito sa bahay, we do chores. We try to see what needs to be done or ano yung kaayusan. So may routine na kami, schedule na kami of what to do. But we can still improve that. And it's comforting, no, na kahit parang busy ka, you're also close to your family. So parang we just have to maintain that kind of balance na you just can't work all throughout the day. You really need to reach out to people or mag downtime tayo, mag quality me time to go over things that maybe na-postpone natin before, but we have much more time now. Tandaan natin, no, na nawala na yung commuting or going to the office, and yung mismong physical presence natin in a lot of these activities that we have. So ngayon, it's just a matter of going from room to room or from floor to floor within your household, within your home. So let's really be thankful for that kind of blessing. But at the same time, the challenge is for us to try to somehow maintain yung sanity natin kasi when we're trying to parang handle or manage itong nangyayari sa atin sa pandemic, marami pa rin tayong mga anxieties, and some of us are getting depressed actually at home. Dati kasi nakakalabas tayo pag weekends or pag after office hours. Now we really have to keep ourselves busy and try to be productive at home. At the same time, try to be comfortable dun sa ating niche sa bahay, kung saan tayo makakapagbasa, we can think, we can watch movies, or we can while away the time, or maybe try to do something or some hobby na na-postpone na natin from a long time ago. So I guess yun, that balance will have to be there, and we still have to be conscious of what's happening physically as well as mentally and emotionally.
Agree ako dyan, Doc. Yung nakakaano na sometimes you will get to really feel na you wanna go out because this is again not normal for everyone. We miss the outdoors, we miss interacting with people, pero merong letter S na kailangan natin lahat pakatandaan, and that is yung sacrifice. Kailangan natin mag-sacrifice ngayon muna kahit sandali because we need to think about not just ourselves, but everyone. Again, we keep on talking about this one, Tricia, right? Wherein hindi pa pwedeng isa lang, ikaw or ako lang ang mag-survive. Dapat lahat tayo mag-survive dito. And the only way we can do that is if we all become unselfish. Konting sakripisyo lang. Pilipino, 'di ba? So, ikaw Trish, ano ba? Any thoughts about grabe na ano ako dun sa sinabi ni Doc? Na inspire ako dun sa sinabi ni Doc. Kinilabutan, na inspire. Dami. What about you, Tricia?
Right. Ako, I agree with what Doc said na this time you have more time for yourself, and do yung mga bagay na na-postpone mo when you were still working, when you were busy with what's happening about your life. This time I think medyo na-postpone yon. Maybe you can do something about it. Ako right now, I've been into meditation most of the time. Mas madalas na akong nagme-meditate, on my idle time. It helps me feel grounded and also para bang nare-recharge yung emotions and mind mo na you just move on and forget everything and have a fresh start naman after that meditation. So
Agree ako
that
dyan.
really helped me a lot.
Wow.
Okay
yan, Tricia. Tuloy-tuloy mo lang yan, ha?
So thank you, Doc, for
yes.
those inspiring words.
Yeah, Doc, any final message, to our frontliners or to everyone who is actually battling this pandemic?
Yeah. Thanks. Thanks, Chino and Tricia. Bale, it's often said, stay safe tayo, stay safe, ingat. And
thank you.
Pero kailangan talaga natin, as you said, Chino, we have to do it together, and we have to really watch out for each other ngayon. So, konting pagpapaalala lang, and ang kailangan talaga natin yung kindness. Sometimes nawawala na yun dahil we take things for granted that things are happening fast, and ang mga tao talaga maraming kinakabahan, maraming di sure kung ano mangyayari within the next few weeks, next few months, or later this year. And again, yung macro level natin, yung economy natin is tanking. So hopefully, sana makarecover tayo pretty soon. there's no way to go but up na since we're really down na ngayon. So when we do that, we rise again. We'll do it all together, and that's something to look forward to. So ingat-ingat lang tayo. Wear the mask, physical distancing, all of those things. Maliliit na bagay pero ang laki nung magiging impact niya when we put all of those little efforts together.
All right. Wow. Doc, anyone else that you would like to thank? Meron ka bang gusto i-promote? Baka meron ka ng sponsorship. Hindi namin alam, ha? Joke lang. Pero you wanna say thank you to anyone or to whoever?
Syempre, I'd like to thank my family, of course, and those that I work with in the government. A special shout out to my friends at UH. They're really taking a hit kasi aside from the hard work that they're doing, syempre ang daming criticism and nothing is enough kasi sobrang dami yung mga ina-ask natin from people. Some of them are ordinary people but they are doing extraordinary things just so that we can have a better way to respond to this pandemic. So special shout out to all of my friends and colleagues who might watch this, and sama-sama lang tayo dito and hanggang dulo tayo kakasama.
All right. Again, thank you very much, Doc Troy Gepte, for actually being a part of our show. It is a pleasure. Sobrang dami ako natutunan, Tricia. And
Right.
again, I keep on saying, got really inspired by the many things that Doc was able to share earlier.
Correct. And we would like to dedicate this episode to all frontliners out there who is actually helping us fight this pandemic. We salute everyone, and also we
Yes.
appreciate all your efforts. All right, so
Salute.
catch us again on Friday at 8:30 p.m. That's our Friday booze night. So don't forget to bring your drinks. Okay, I hope you enjoyed our episode today. Talkers, signing out.
Bye, guys. Have a great evening. Stay safe.
Bye.
Bye.
Bye.